Step 4. Advise. Discuss benefits and risks. Based on what you know about the mechanisms of hypoglycemic agents, you decide to propose decreasing or stopping Linda's aspart insulin if you both agree on a higher A1C goal. Even if her A1C goal stays the same, you know she will benefit from taking less insulin or discontinuing glyburide, since she's had multiple probable hypoglycemic episodes.
Here are your choices. You can keep your A1C below 7, or you can change the number of your A1C to a number between 7 and 8. If you stay below 7, you may have more energy. You might not have the problems that come with having diabetes, such as damage to your nerves or eyes. But on the other hand, if you stay below 7, it's more likely that you would have low blood sugar, and you would need to take medicine, and you would need to come see me more often. I know that's a lot of information. I want to make sure that I explained it clearly. If you were to tell your daughter some of these changes that might come up, what would you tell her?
I could prevent damage to my nerves or eyes.
And you might have more energy. Now, what might happen if it stays below 7?
After confirming Linda's understanding, you hand her a simple decision aid to help her think about what less and more control means. You suggest she take it home, talk with her daughter, and think about her options.
Either way, we're going to need to watch your diabetes closely for a while to see how the changes work for you.
Step 5. Acknowledge criteria upon which the decision will be made.
As I already mentioned, the evidence tells us that an A1C of 7 or below is not best for all patients. We already know that you sometimes have low blood sugar and that you have some problems from diabetes. I understand that you want to take less medicine, have fewer headaches, and feel safer now that you're living alone, and that's important to you. Anything else we need to consider?
No, I think that's it.
Okay. You have two choices at this point. You could stay where you are now with your blood sugar below 7, but with more chances for low blood sugar. Or you could try for the higher A1C number, with fewer chances for low blood sugar. If you try for the higher A1C number, we could try that for 3 months and see how you feel.
Step 7. Make the decision.
So how about we meet again in a couple of weeks to give you time to think things through? Or if you're ready to decide now.
If you think the higher sugars are okay and not too dangerous for me, I'll try it.
Okay. So let's try it for the next 3 months and see how you feel when you come back for your next checkup. In the meantime, we'll have a nurse from our office give you a call to check in on your fingerstick blood sugar values.
You give Linda simple directions on how she should take her medications moving forward and ask her if she would like you to text them to her. Then you do a quick knowledge check using the teach-back method. Step 8. Evaluate and follow up.
All right, Linda. See you in 3 months. And be sure to make an appointment at the front desk before you leave. And I will be available if you need to call me with any questions or concerns before then. All right?
I will.
Good.
Thank you.
Sure.
Thank you.